You're listening to Health Professional Radio. Today my guest is Tim Humphries, Chief Executive Officer at Homestyle Aged Care, and Tim joins us from the beautiful Australian state of Victoria. Tim, welcome to Health Professional Radio.
Thank you, Wayne.
Now, Homestyle Aged Care gives me a pretty good idea of what you're going to tell me, but why don't you explain it to me anyway and tell me a little bit about Homestyle Aged Care?
Absolutely, I'll be happy to do that. We're a Victorian-only provider of residential aged care, so we have 10 homes spread throughout metropolitan Melbourne and also Geelong. So we have 3 homes down in the Geelong, Bellarine region. So the services we provide are, as described, residential aged care as the government defines it. So we basically care for older people who are, in most instances, not able to care for themselves in their own home or even able to live in their own homes with the care of others. So that's what we're charged with doing, and we've been in operation for some 26, 27 years now. I've been here for 2.5, so I've inherited a legacy of some really good managers prior to me, so I'm pretty happy with the organisation we work with because I think we provide quite good care to those who we look after.
Now, Tim, you say you've got 10 homes, but can you give us an idea of how many beds that translates to, just for those clinicians who are listening who measure everything in bed numbers?
I was trying to avoid that. 964 beds.
964?
Yes, we do have some growth plans, so that'll extend up over 1,000 over the course of the next couple of years.
Now, that would make you a fairly big provider, I would have thought, in Victoria?
Yeah, we're probably one of in the privately owned space, we'd be one of 3 or 4 who have that sort of 1,000-bed mark. I think there's a few in the 500-bed space, but there's not a lot at our size. But as I said, it takes some time to build a business of this scale when you're a privately run business. There's certainly been some aggressive growth in the other publicly listed space, but a bit harder when you're generating cash privately.
Now I just assume that you meet all the accreditation standards and all the rest of it.
We don't have too many choices around that. That's a government requirement. Absolutely.
That's why I made the assumption, yes. So, but tell us, how do you distinguish yourself? What are the characteristics of Homestyle Aged Care that you would put in a brochure for prospective residents?
That's a great question, and it's something that I had to really think through over the course of the last 6 months when we redeveloped our website. And I think for me, one of the things that stems from the board downwards, and the board comprises 4 people who have all been with the business since its inception, one of the things that they have never compromised, and I'm fortunate to have inherited, that we won't compromise care for the sake of profitability. So I think that's one of the great things about working in a smallish organisation. We have the opportunity to actually make sure that care, which is our business, is paramount, and we make sure that the care our residents receive is at a level that we're comfortable with. So it's always our priority. I mean, obviously we want to maintain a business that's sustainable into the future, but there is understanding from the board all the way down through the organisation that care is what we do here. So I think that's one of the things that a lot of people say they do, but I'm really pleased that here in this environment, as I say, from the board to myself, to our exec team, down through our facility managers, to all of the team that work with our residents, everyone has that focus on care, which is fantastic.
Now, Tim, many of our audience are clinicians of one kind or another. We get a lot in acute care and a lot in aged care. Is there a message you'd like them to hear from you today as a result of being on Health Professional Radio?
Oh, that's a tricky one. I think one of the things that we often hear is that the acute setting is somewhere, there seems to be some animosity between the two sectors, and I'd love to see that reduce. I think we're all doing our best to provide the best care we can to the individuals we're charged with looking after, and I think the acute sector has its challenges, and obviously that sector is trying to move people out of their beds as promptly as they can for reasons that we're all fully aware of, and we're sort of at the reverse end of that spectrum. We want to keep people as well as we possibly can for as long as we can, and I'd love to see a day where there was a mutual respect between those two sectors, and I hope I'm still working to see that occur.
Yes, it would be good to see. I'm in conversation with Tim Humphries, Chief Executive Officer at Homestyle Aged Care in Melbourne, Australia, and you're listening to Health Professional Radio. My name's Wayne Bucklar. Tim, in every industry and every endeavour there are always misconceptions. What's the biggest misconception amongst your customers, clients, patients, residents? What's the biggest misconception that keeps you awake at night?
I don't know that it's a misconception, Wayne, but one of the things that we find, and it's interesting to see in the roadmap that the government's just released, that there's a push to try and encourage people to proactively think about residential aged care. Mm-hmm. I think most people, and the evidence that we have of people entering our care, most people enter our care at a point where there's a crisis. So, perhaps a hip's been broken or some other acute health issue has arisen that sends people to our care. And, I think what we see within our sector are people who move from a home setting to our residential aged care setting, and often their lifestyle and their health improves as a result of living with us. And I think that's probably the key misconception, that it is somewhere that people, in essence, come to end their time on this planet. Whereas we certainly get the benefit of seeing socialisation for some residents who have been isolated. We see the improvement in health as a result of taking medications that perhaps haven't been taken in the home setting. We see people gain weight where they've perhaps been slightly malnourished in a home setting. So there are some actual, there are some real tangible benefits that we see people receive as a result of the care we provide. And I think perhaps the misconception is that most people's health slowly deteriorates in aged care as, of course, they age, but it's not always the case.
Well, let's hope that today, amongst our audience, we can help spread that message just a little. Tim, I do appreciate your time. I understand you're a busy person, and I appreciate you giving your time to us today.
It's my pleasure. Thank you, Wayne.
Now, if you want to get in touch with Tim Humphries from Homestyle Aged Care, the website is Homestyle Aged Care. That's all one word, homestyleagedcare.com.au. If you'd like to listen to the interview I've just had with Tim, the good news is on our website is both a transcript and also an audio archive on YouTube and SoundCloud, and you can find links to all of those resources at the Health Professional Radio website at www.hpr.fm. You're listening to Wayne Bucklar on Health Professional Radio. Thank you for listening to us today.